We're going to drive to the next slide. You a little bit of the background of how FT3 and GPON started working together. So GPON comes from Global Power of Oncology Nurses. If you don't know it, by the end of today, you will know who GPON are and you will join us in our WhatsApp group. But we try to make education and accessible for every oncology nurse around the globe. We want to focus more on those people that are coming in low and middle income countries. So we are interested in similar things that we have spoken on these last webinars around education, around advocacy, around working together. And I was working in Precision Oncology, hereditary cancer, and I was collaborating with this other organization that is called FT3, that is from testing to precision oncology, so that they try to make precision oncology accessible for all patients and understandable for all patients. And we saw a massive interest on our GPON WhatsApp community around precision oncology. So that's how all of this started. So it started from actually all of you expressing interest around precision oncology. And we decided to join together because we aim to address those challenges around precision oncology, but around oncology care as well, to improve these collaborations between us and also other professionals. So FT3 is not a nurse. It's not a nurse organization. It actually has patients, pharma. It has many healthcare professionals. So it's a really nice opportunity to listen to different views around the same topic. To empower all of us, that is why I hope that you get a little bit from today, and ensure also, as I said, that's GPON main thing, ensure that nurses have resources, support to excel in oncology, but in this case, around precision oncology. So that's how we both came together. And that's how the sessions come up. And we are going to explain a little bit about what have happened, our journey so far. So I'm going to give the floor to Osioma, who will be introducing a little bit of the work that we have done until today.
Thanks, Celia, for the great introduction. Hi, everyone. Thanks for joining us today. My name is Osioma, and I am a program manager for FT3, which is from testing to targeted treatments. And as Celia mentioned, we are a multi-stakeholder global consortium which seeks to make precision medicine equally accessible to all patients that can benefit from it, so that the right patient can have the right access to treatments at the right time. And so, like Celia said, especially for those who are new, I'd like to take a moment to give us a bit of context on the journey so far and what we have learned from the workshop so far. So indeed, there was a massive interest in the beginning to support the nursing community and to help them in implementing precision oncology care. And we began this journey by first seeking to understand what are the challenges that nurses face. So we did an extensive literature review and also had interviews with a number of you here today to really understand what are the different challenges, the different healthcare contexts and in different geographies. And then we also proceeded to find out the patient perspectives, because the patient's perspective is really core to what we do at FT3, because our ultimate mission is to drive better patient outcomes. So we had a session where we brought together healthcare professionals, specifically nurses and pathologists, and the patients, and we had the patients tell us exactly what it is that they needed from their healthcare provider at each step of the care pathway. It was also an opportunity for the healthcare providers to also give a bit of insights to the patients on what their roles are at the different steps of the pathway. So it was a really informative session for both sides. And exactly as Celia said, FT3 is not necessarily like an implementer, but we are more like a convener. We bring people together and we try to accelerate co-created strategies and co-created solutions. And so this is one of the bases of establishing a platform where we can bring together nurses and nursing societies, where they can not only facilitate peer-to-peer learning and share best practices, but also come together to think and co-create, solutions that are relevant to the different contexts and to the different needs that have been identified by the nursing community. And so, Ellie, please next slide. this brings us to some of the things that we have learned in the other sessions. So the first session, we took the opportunity to discuss all the challenges that we had heard from the nursing community, and we did something like a ranking, which led us to the top 10 opportunities to address nurses' challenges in precision medicine. And as you can see on the screen, you can see some keywords that stood out, and they were education and training, recognition, multidisciplinary team inclusion, communication and collaboration, just to mention a few. And during the last session, we focused on strengthening nurses' education in precision oncology and figuring out what is needed to make this happen in practice. And so we had three main themes standing out as those things that could really help to accelerate nurses' education in precision oncology. And these are collaboration, resources, and policy support. Under collaboration, we spoke about empowering local champions to scale knowledge, and this includes implementing train-the-trainer models, and also fostering multi-stakeholder alliances. And by this, we mean bringing together nurses and nursing societies, partnering with patient organizations, NGOs, academia, to develop context-relevant educational training and educational resources. Then for existing resources, we spoke about tailoring them to be culturally relevant and to be accessible. That includes translating them into different languages, having them easily accessible or maybe consolidated in one place if possible, and categorizing learning content according to complexities. So we're talking about having a consolidated place where different resources are there, but nurses can access them in terms of those that are basic, those that are intermediate, those that are advanced. So, and then one more thing that stood out during the session that the nurses said could really help in making nurses' education more efficient is helping to recognize and leverage nurses' impact in order to drive policy change and advocate for more sponsorship programs and also scholarships for education. And so moving on to our focus for today's session. Next slide, please, Ellie. We will be focusing on recognition and also advocacy. So yes, indeed, it's mainly advocacy, but one of the key things that stood out during the first workshop that we had was that there's a lack of recognition for the nurses' role when it comes to precision oncology. And then also during the last session, nurses were really big on, empowerment to advocate for not just not just to be recognized within the healthcare ecosystem and within their teams, but also to advocate, to be recognized as people that can partner with patients to advocate for better patient outcomes. So these are the two angles we'll be visiting today when it comes to accelerating nurses' recognition through advocacy. And next slide, please, Ellie. Yeah, I will just hand over to Celia now to take us through the next phase of the workshop.
So it's actually my time to give the floor to our three wonderful speakers. So they will, as I explained, give some case examples around success stories on nursing advocacy. And we will start by Gilani De Castro. So you are very welcome, and I'm so happy that you are here with us. The floor is yours. I will appreciate if you can also tell us a little bit of who you are.
Certainly. Good morning, everybody. Good morning from California. I'm very excited to be here, and just seeing where everyone is from all over the world is very energizing for me. I don't need coffee this morning. I think that was enough to wake me up and energize me. I do want to give a special shout out to my colleague, Darcy Burbidge. She's on the other side of the country, but she's also a wonderful connector and a wonderful nurse and advocate. And I am going to talk about advocacy, which is one of my passions, but my background is currently I'm a nursing director at City of Hope National Cancer Institute in Southern California. I also am the president of the Greater Los Angeles chapter of Oncology Nursing. I'm the legislative director for the American Nurses Association of California. And I didn't want to burden the slide with too many words, but I will also sit on the legislative committee of the Philippine Nurses Association of America. So a little bit of my background, and again, too, with here in the United States, we're kicking off Nurses Week. So this is a wonderful way for me to be surrounded by this wonderful community of nurses and celebrate the profession, which I love so much. So we'll get into it here, the power of influence shaping nurses' future through advocacy. So I always like to begin with this quote, especially if there's a group I'm speaking on advocacy with that aren't familiar with the concept. So some of you may have heard this before, but this is something that inspired me early on in my journey. If you don't have a seat at the table, then you're probably on the menu. And this applies to anywhere you happen to be today, whether you are at your work, in any organization you are, even if you are planning dinner for your family tonight. If you aren't there, they're going to cook something that perhaps you don't want to eat for dinner. But, as nurses, we really need to recognize that there are tables that we need to sit at in order to drive change, in order to advocate, not just for our patients, but ourselves as well. Next slide, please. So a little bit of my journey. I know I listed all of the organizations I'm with, and sometimes when I look at my resume, I really think, how did this happen? How did I get from where I started on the side of the screen where I'm administering chemo there? I used to work at a university hospital in Los Angeles, where I was an infusion nurse for many years. I also worked in clinical research. And I thought I would retire from that position. I was maybe in my early 30s at that time, and I couldn't see myself doing anything else. And then fast forward to 2024, where I was at the ONS Congress in Washington, D.C., where I was talking to, it was a fairly large audience of oncology nurses about my involvement in advocacy and some of the work I did. So I do want to go over my journey this morning. Just bear with me. I might get a little off topic here, but please, Eleonora, please just bring me back on topic if I stray too much. But I really want to drive home the fact that advocacy is something anyone can do. You don't need a political science degree. You don't need background. So next slide, please, Eleonora. So again, I was in infusion setting. I decided to go into a leadership position just because I was in that point of my career where I've done many sorts of nursing except leadership. So I moved to City of Hope, where I was a nursing supervisor and an infusion clinic. And the timing, of course, as you see the date there, March 2020, it was when the pandemic hit us, especially in healthcare, right? We were very hard hit, and everybody was really at a loss what to do, something that we haven't experienced in our lifetime here. So March 2020, that's when the pandemic really hit full force here in the United States and California. And as many countries were trying to navigate their way through it, and we were going through the same things. How are we going to care for our patients? Where were we going to get supplies? And not to mention our own personal concern and safety for our families as well. So that's when I really realized that nursing, whether here in the United States or globally, had really a share in the failures of what happened in the pandemic. And the reason I say that, because I was going through all the stages of grief, as it were, like anger and denial, like how did we get to this place? And I always thought as a nurse that someone was taking care of us because we have important work to do. We have patients to take care of, lives depend on us. So we have somebody taking care of us somewhere, whether it's the government or our institution or our CEO. And I came to the full realization that there is no one taking care of us. And actually, we have to step into that role because nurses, nobody can lead nurses as well as nurses can, and we shouldn't depend on anyone else. So coming to that realization, I started doing research and I started joining webinars. And at the time, the world was closed down. So all I could really do, as with many of you, I'm sure, was just listen to podcasts or join webinars. But for some reason, I kept getting steered into advocacy-focused webinars through nursing societies, especially with the Oncology Nursing Society. They have a very strong and robust advocacy arm here. So I was very inspired about the work the Oncology Nursing Society did. And in fact, I didn't even know that nurses could do something like this. I didn't know that nurses could advocate for patients beyond the hospital. I didn't know that nurses could speak to their lawmakers. I didn't know nurses could really drive health policy beyond the organization. So this was something completely new to me. And again, coming from the background of working with direct patient care, my view of advocacy was patient advocacy, advocating for our patients' orders, advocating for whatever the patient or the family needed in their immediate care. So it was a very new concept to me. And I joined a conference when the world started opening up again. I joined a conference that ONS was hosting in Washington, D.C. And I found my community, I felt like, and I believe Darcy was there in that conference as well. But it was nurses that wanted to be involved in advocacy or already involved in advocacy. And I was so inspired by the work that many of these nurses were doing in terms of looking at climate change or looking at precision medicine, biomarker testing. And, you know, all of a sudden, just my brain just opened up like, wow, the nurses are so powerful. Not only are we one of the most educated professions, but also we have the experience of being at the bedside and living with our patients through their journeys and holding all their stories. I'm sure as a nurse, you have stories that a patient told you many, many years ago, but it still speaks to your heart. So again, with those stories inside of us, we are really poised to advocate. Next slide, please, Eleonora. So with that journey and learning more tools from the Oncology Nursing Society, also through my state chapter of the American Nurses Association, I learned more about advocacy. I learned that, you know, nursing has a lot of skills already. We don't have to technically go to school. We have a lot of skills to advocate beyond the bedside. And finding my community of nurses, we decided to replicate that experience we had in Washington, D.C. and speaking with the lawmakers there to bring it to our state here in California. So in this picture here, over the course of 2 years, March 2023, March 2024, we assembled a group of nurses, not necessarily oncology. Everybody was welcome to join us. And it's a 2-day event where the first day we had speakers and the focus was on advocacy. Our topics range from how a bill becomes a law, the importance of advocacy in environmental health, talking about biomarker testing, but we also invited lawmakers, politicians to join us to talk about their best practices and also give us tips on how nurses can better engage with their offices to speak about our issues. So 2023, 2024, and then this year, we are in our 3rd year. And in fact, after this webinar, I'm going to be joining my colleagues. We're going to be kicking off our 3rd event this year again. So when I reflect back on this journey where I didn't even know nurses can do this, and now going into our 3rd year of the Advocacy Summit, I'm very proud of my colleagues because it only starts with one idea, one thought, and nurses are very good about building community. And this grassroots effort is something that nurses are already good at. I mean, think about your institutions. Whenever there's a birthday or celebration, I mean, how quickly can we throw a celebration together to celebrate somebody? And this is the same thought. We didn't have any money per se. These were different chapters of the Oncology Nursing Society, but we funded ourselves. For example, someone offered conference room at their hospital. Another person husband knew a politician and, asked that politician to speak for us. I was the admin for everything. And so I poured my time into doing that in order to keep us going. So it was a very inspiring event. And within 3 months, we were able to kick off our first advocacy summit. Next slide, please. So the work continues. So aside from the Advocacy Summit, I'm also active. And again, I have this core group of nurse advocates that keep inspiring other people. And as you know, with any community like that, you have that synergy and you always want to achieve more. So I also didn't want to stop my journey. I wanted to keep learning. So I took part of different advocacy institutes. I joined different fellowships. I started a podcast, which right now I'm on a break just because I'm doing too much from there. But I'm also leveraging social media a lot because nurses aren't generally in the spotlight. And I think that really needs to change. And we have to be our best advocates, and we have to leverage social media as a tool in order to highlight the wonderful work we do. I think among the nursing community, especially here today, we know about the achievements we have, the research, the breakthroughs that there are in our institutions. But does the world know that, right? Do they know that? We're one of the most trusted professions, but I think if you ask generally someone on the street there what nurses do, they can't really verbalize other than perhaps what they see on TV. So I leverage social media a lot in order to celebrate nurses and celebrate what we do. Next slide, please. So with that background, I want to focus on you now. How does advocacy apply to you? What can you do in your immediate institution or community in order to advocate for what you're passionate about? So when on the slide here in the very bottom, it says you, which is the nurse. And generally you report to somebody above you. If you're working in a hospital or clinic setting, your boss reports to whoever runs the hospital. But I think most nurses don't know that there is a connection between the bedside and the government. At least here in the United States, there are many laws that dictate how we care for our patients or regulations on how we carry out our care or even safety and oncology. So my mission is also to help nurses realize that there is a connection of what we do in patient care and what is happening at the government level. Next slide, please. But also shifting that focus from having you as the nurse at the bottom of that hierarchy, which you're not really at the bottom of the hierarchy, but it may feel like that. But I do want to shift your focus to the nurse as the intersection of healthcare. If you think about the hospital setting, and I know many of you don't work in a hospital setting, but this applies to anywhere you happen to be. Nothing can happen without the nurse. You have the doctors, you have the social workers, you have all the other allied health staff. But the nurse is the center of that care, and we are the direct line to the patient. So we have power in that. And I think for many years past, nurses have a very passive role. Not that there's anything wrong with that. I mean, we're doing our job. That's what we are there to serve our patients. But really to wield that influence that we have over those that are conducting their care through us. We are the subject matter experts. Patients trust us with their stories. You walk into the patient room or the clinic or wherever you happen to be, and how many times has this happened to you where the patient is telling you all these stories and they just met you, 5 minutes ago. So we have to also wield the power of nursing as one of the most trusted professions. Again, nursing these days is one of the most educated professions too. And our training is very intensive. So, it is much more than just providing bedside care. Nursing has evolved so much into something that the general public doesn't understand. And we're the largest workforce in healthcare globally. I don't know the numbers on that, but I imagine there are more nurses than physicians, right? Or those in the other healthcare disciplines. So instead of viewing us as on the hierarchy of things as someone that receives orders and carries out orders, I really want to shift people's focus into understanding that nursing is the center intersection of healthcare. Next slide, please. All right, so the nursing advocacy can mean many things to everyone, and there is no wrong answer. But so this is how I define it.
Maybe there are challenges with audio. You want to try again?
Yes, I'm sorry. I don't know where that
That's
came
perfect.
from. All right. So nursing advocacy may mean many things to many people, but here are some concepts of how nursing advocacy is as I view it. So it is the nursing process. Again, if you think back at your nursing 101 training, this is what we learn. We advocate for our patients through the nursing process. It's nonpartisan, so meaning as we care for patients, we're not thinking about their political affiliation. We don't care for a person because of a certain religion or because they're not of a certain class or anything, right? We are there for the patient no matter what their background is. And there are your national and international code of ethics. So these are the concepts that I've really learned to embrace from the nursing 101 to my more advanced experience in advocacy. Next slide, please. So again, just quick review of the nursing process. I know all of you know this, but this is the main reason why we're equipped to influence policy. As we approach patient care, right? We follow this process of assessment, diagnosis, planning, implementation, evaluation. And when you're looking at legislation, when you're looking at health policy, this is the same process. And so you don't need to learn a whole new skill set in order to advocate beyond the bedside. Next slide, please. And so I want to share some easy to attain best practices of how you can advocate today in your community. If any of this resonates with you or inspires you, these are some very simple ways that you can start having a seat at that table. And I know that this is a global forum, so it may be different in your country, but I think with these basic things, this is a way that you can start having a larger voice. So register to vote and vote in every election if possible. Know your elected officials. I think that a lot of nurses think that this is outside of our realm, and it's not outside of our realm. If you know your elected officials in your community, your local community, you don't have to think about the national level. How health literate are they? Are they friendly with health policy? Are they even aware of health policy? And as a colleague of mine said, as nurses, we teach our patients, we teach our families about their condition, right? We're educators. So we may as well educate our elected officials and build that relationship. Much like our physician colleagues, if we need an order for something, right? You build that relationship so it becomes easier to discuss the care of the patient. If you're able to, you can share public commentary or feedback on policy. There are some places where, especially on regulations, you can provide feedback. Join a professional nursing organization, which is also a very easy thing to do. And many of these professional nursing organizations have action alerts, which you can also just by email respond through. You can also speak to a legislator or policy leader. And again, it doesn't have to be a formal conversation. It can be, hello, Mr. Smith, I'm a constituent in your community and I'm a nurse. I'd like to talk to you about this, or would you like to learn more about what nurses do? It can be something as simple as that. Also leveraging social media. My social media platforms, I use the name Citizen Nurse and or Nurse Jelani. And again, it's to educate the general public on what nurses do, and also highlight advocacy. And there's plenty of social media out there that portray nursing, maybe not in the most professional light, but I think especially as nursing leaders, we can help reframe that narrative so that we can show the professional practice of nursing through social media. And also, as many of you are doing, you're contributing to research and different projects or sharing local data. And also framing policy as a core part of nursing practice. One very simple way to do this, as you have your huddles, if you have your meetings, in any opportunity you can, add a piece of legislation, healthcare legislation, to the agenda, and just have it as a discussion topic. And it doesn't have to be something big. It can be something as simple as biomarker testing, or maybe the cost of oncology medications. And again, normalizing the conversation with your nurses that may not have access to or know about advocacy, so that they know that it's okay to talk about laws related to healthcare, or to talk about these things as part of their day-to-day practice. Next slide, please. And again, this is another graphic, very simple way nurses can influence legislation. And it doesn't have to be a very heavy lift. It doesn't have to be difficult at all. And being knowledgeable on issues is something that, as nurses, we're subject matter experts on. And so I ask you, to take one step further and take a look at a healthcare legislation and see how that affects your practice today. Next slide, please. Oh, and I'm so sorry, Eleanor, if you can go back just one more slide. I missed a very important part. And perhaps I'm inspiring some of you today, maybe not now, but maybe in 5 years, if you so desire to run for political office. That would be wonderful, because to have a nurse at that high level is just amazing. And in the next slide, this was taken 3 years ago, maybe 4 years ago. Darcy is somewhere in the audience with me there, but this was in Washington, D.C. with oncology nurses at what we call our Capitol Hill Day, where we talk to our politicians. But in the center there, in the green dress, is a nurse, and she is a politician from Illinois. It's one of the states in the United States. And she is one of 3 nurses in our Congress. And so we're very fortunate that we have this nursing voice that advocates for health policy, and she's a very big proponent on maternal health. But again, that's 3 out of hundreds of politicians. And it doesn't have to be at a very high level of government. I mean, nursing can be involved in your local community as well, because in fact, the things that happen on the local level impact your day-to-day more than the things that happen on the federal level, or at least more quickly than laws that are made on the federal level. Next slide, please. And so from the International Council of Nurses, it's a part of our code of ethics. The reason I bring this up is you may get those voices that may say, oh, nursing shouldn't get involved in politics, or nursing shouldn't go out of their lane per se, right? But actually it is our code of ethics to be involved. We value human rights. We value the individual, no matter what customs, religions, spiritual beliefs, whatever background they come from. Our professional code of ethics compels us to care for the human condition. So also that's one way that I respond to people that say, oh, this is not something that nursing should do. When in fact it is something that it's the reason why there is nursing is because we care for people and we want to advocate for the best for them. Next slide, please. And if you'd like to learn more or have questions or anything at all, I'd love to connect with people. Please find me on LinkedIn. I'm on social media, TikTok, Instagram, YouTube. And actually, if you watch the YouTube and the social media, you can see the progression from many years ago where I really didn't know much about advocacy till now. So, and I'm not I'm not embarrassed to share that I was new to it before, because there's a starting point for everybody. And in fact, my dream with nurses in advocacy is for someone to do it better than me, or say, oh, Jelani, I think you're wrong. I think you should do it this way. And the reason I want someone to challenge me on those things is that we've started a conversation, and that we're building a community, and we're growing a community. So I'm always happy to connect. I'm always happy to speak with anybody about advocacy. And if you get to know me better, you have to tell me, can you please stop talking about it now, because you know we don't have time anymore. But again, I'm very happy to be here. Thank you for giving me this time to talk about what I am very passionate about.
Oh, thank you. I'm sorry that you are not a big audience, so you can hear us clapping, but we are. I can see Julia, Eleonora, and I can see the powerful. Actually, you already have votes, so you should be the one going to politician, because here there are already a group of people who want to vote for you. Thank you so much, Jelani. It
Thank
was
you.
super inspiring, and I'm immensely proud of having now Tuti also joining us, who has many powerful stories, but I did ask her to share with us some of her experience, not in oncology, but actually I think it's going to be a very powerful thing to listen to. So thank you so much, Tuti. As I said to Jelani, please tell us a little bit of who you are, and the floor is yours.
Thank you very much, Celia. Good afternoon, everybody. It's such a pleasure to be here amongst oncology nurses. I always love the company and the leadership within oncology. So I'm very proud to be one of your speakers at this session. So I'm Tuti Bueza. I'm a clinical academic with a background in cardiovascular genetics. My day job is Director for Nursing and Midwifery at the Southeast Genomic Medicine Service Alliance, and I'm based in London. And also I'm an academic at King's College London. And I've got some other sort of affiliations there, but what I forgot to put there, which is quite important in terms of advocacy, is I am a trustee of a patient organisation called Cardiomyopathy UK. And today I wanted to just give you an example of how being at the table, as Jelani says, is really important. We have really important contributions to policy and to how eventually we practice our nursing to benefit our patients. So I was part of a campaign, and I'm still part of a campaign called Cardiomyopathy Matters, and this is a multi-stake European initiative to improve patient outcomes in the field of cardiology. So the next slide, please. So cardiomyopathies are quite a common condition affecting about 1 in 250 of the population. It's a structural heart disease that is inherited and can be inherited. It confers a risk of sudden death and substantial disease burdens because it's a chronic condition and can be reduced through better awareness, detection and care. And specific considerations for cardiomyopathies are not usually incorporated in health policies because they focus a lot on coronary heart disease, which is more of a sort of a lifestyle related condition. And in fairness, a bit more common, but actually this is also emerging as something quite common in the population. Now, the European Society of Cardiology released some new guidelines on cardiomyopathy, and this focused on early diagnosis, but also genetic testing and all the development of the precision therapies that are developing for this particular condition. So not very so very, very similar to cancer, where more precision therapies are being developed. So this campaign, Cardiomyopathy Matters, is a Europe-wide multi-stakeholder initiative. So we wanted to raise awareness about cardiomyopathies and to ensure that they receive the policy attention that's warranted throughout the European Union and also the national decision makers, because you've got the overall sort of governing body that is the EU, and then you've got all the member states and member countries around that who have to then develop their own policies based on their interpretation of that sort of umbrella policy from the EU government. And in the next slide, you can see that the way Cardiomyopathy Matters was conducted is very much what FT3 is doing. It's a co-production and collaboration So the participants included experts from the fields of cardiology, cardiac nursing, patient advocacy. There was a secretariat that was coordinating it in Brussels. And so there were representatives from 10 countries and 7 centers, meaning sort of provider facilities, health provider facilities, and 6 patient advocacy or multi-stakeholder groups. And the co-creation was based on reviews of published in literature, but also input from all the participants through group workshops, consultation meetings, and a modified group technique to make sure that the draft was accessible to all, and there was a consensus following the drafting of this roadmap. And so the outputs of our work, in the next slide, you can see that there was a policy roadmap that was launched at the EU Parliament in November 2022, and there were 3 members of the European Parliament advocating on our behalf. And we have some publications that you can find in our website. And then there are, stemming from this, there are national cardiomyopathies matter initiatives underway in the various member countries. So this is just a photo of us. I think this was after presentation at the EU Parliament, and there were some patients that were with us, and they shared their stories. But alongside the clinicians and myself, we shared our stories about our kind of challenges in terms of what is important to patients and what are the gaps in practice. So I think in the next slide, you'll find the priorities that come out of this EU policy roadmap. So it specifies the unmet needs and challenges of patients through their pathway. And then we made some recommendations to ensure holistic EU and national policy once they kind of set out any sort of cardiovascular policies to improve patient outcomes. And I think it's in 2022, can you believe that the EU didn't have a cardiovascular health plan? It's a very important and major disease and cause of death amongst the population, but they didn't have it at that time. So, but some countries did have it at national level. So that was one thing that was very much that came out of this piece of work. But then there were the policy priorities that we wanted to emphasize when they do formulate this cardiovascular health action plan. And this is around cardiomyopathies, early diagnosis. This is obviously very important in oncology too, for better treatment and better outcomes. And then access to specialist care, making sure that disease management is adequate and within centers that are, have the right teams. Holistic support, making sure that the assessment and supportive care and inclusion of patient organizations are also involved in the policies, and making sure that patients are empowered through shared decision making, and the digital and data access and controls of their information, and research and innovation, making sure that patients have equitable access to research, and there's good research infrastructures to then support the cutting edge services that are needed to be developed in cardiomyopathies to really kind of sustain that precision medicine aspect within this condition. So I think here in the next slide, I think this is where I think being there as a nurse, I think really helped a lot of the concepts and policies around holistic care, because I think that's something that we provide. I think maybe if you ask a lot of the clinicians or the doctors, they're very much focused on treatments, management, but I think having a nurse there really emphasized the need for holistic care and that sort of supportive care along the life cycle of that patient and their families, particularly around genetic testing and genetic counseling, because there's a lot of testing going on, but not a lot of genetic counseling, which supports that shared decision making. So I think I feel that my contribution here was really supporting that improved knowledge and awareness to promote early diagnosis. And this is not just amongst specialist doctors or specialist services, but all across, even right now, I'm advocating for them with you as oncology nurses, because you might see patients who have cardiomyopathies, and you will have to then tailor the treatments according to this condition. And then making sure that we have rapid referral systems to multidisciplinary care within specialist centers, and really involve the various people that provide holistic care and support for these patients and their families. So, we really have a lot to contribute when we have a seat at the table, and particularly around holistic care. So the next slide, please. So, the 2022 roadmap was very much focused on cardiomyopathies in general and the priorities there. When in 2023, we updated some recommendations because we found that there was needed to be a little bit more emphasis around genomics and genetic testing and genetic counseling, and how this impacts on diagnosis and treatments of patients. But not really just around, availability of a test, getting the patient tested, but knowing what they're being tested for, the implications of this and their families, and actually how this facilitates a lot of prevention, particularly for family members who are at risk, because this is a dominant condition, and therefore first-degree relatives could be at risk for the same condition. And sometimes the first indication or the first symptom is sudden cardiac death. So that really is a huge potential there for prevention. So we put that in 2023. And next slide, you can see now that the national initiative. So we're working on the sort of the central government in Europe around the overall policy and governing sort of support for and care for cardiomyopathies, but then also the people who were part of the stakeholders also took this cardiomyopathy roadmap and tried to implement and start the conversations within their countries. So they were in Belgium, the Netherlands, Poland, Hungary, Romania, Italy, and Spain. They either started the conversations, or some were already trying to put this into their own specific country policy around the care for cardiac patients. So, and there are many more countries now starting as well. So you can see there's a lot more work to do, because this was only just the beginning, sort of in 2023, 2024. And then the next slide. This is, I think, a slight culmination of the 2 years' work, because the EU is a bit like choosing the Pope, isn't it? I think working with the EU, the European Union Council is very slow, not complicated, but I think there's a lot of things that go into the mix before you even get people to sit down and have a discussion about things. And there's a lot of you have to know key players and key people to approach. And this is where the Secretariat was very instrumental, but actually the patients and the clinicians and their stories were very influential. So here is the conclusions on the improvement of cardiovascular health in the European Union, which was in November 2024. And we managed to get in there, considers that cardiomyopathy is part of that spectrum of cardiovascular disease. So it wasn't just hidden in heart failure or in coronary heart disease. It was there as an entity, as a condition that needs to be dealt with. And then in sort of ITIN 31, it kind of talks about rare diseases in general, and how underdiagnosed it is, the more resources are needed for awareness, but also supporting the specialist services to enable the ability to kind of develop services to look after patients. So I think this was a very significant win for us in terms of achieving what we set out to in terms of the EU health policy. And so in the next slide, there's still more work to do. we've got, we need obviously a dissemination campaign amongst health professionals, and there's a paper there that came out recently. But also I presented this at the European Society of Cardiology Association of Cardiovascular Nurses and Allied Professionals conference, where actually the nurses looked at the map and said, hey, I'm on that map and I want to be involved in those national projects. And so that's also helpful in kind of getting more of the nurses advocating for patients within their own countries and their own policies. We're trying to increase stakeholder engagement. This was initially funded by industry, but we're also now trying to expand this to other companies and other stakeholders. And we continue to support the implementation of the EU Cardiovascular Health Plan, working with EU Parliament and all across the governments. And these are just some of the patient groups within the Global Heart Hub that has participated in this campaign. So, I mean, it's been very interesting work for me. Obviously, with Brexit and the UK leaving the European Union, I did feel that, how am I going to have a voice here? This is the EU. But actually, because you're a nurse who's knowledgeable and, you know, able to kind of participate in the discussions and the debates, and all of you have this capacity, you know, you can contribute, and there's a lot of, you know, skills that you think you know you don't have in terms of like speaking up or negotiating or advocating. As Lilani said, you know, that you have so much more skill than you think, that you can have that seat at the table and make a difference. So just I think the final conclusions on my last slide is around, so we still need EU and national cardiovascular health plans, action plans, really to make those robust and implemented, specifically around cardiomyopathies and other inherited cardiovascular diseases. And a campaign like Cardiomyopathies Matter fosters collaboration between healthcare professionals, the patient advocates, and policymakers. So to ensure that all patients and families have access to guidelines-led care. And I think this has its parallels in oncology. And nurses, as you can see, have an important role in advocacy and influencing policy, specifically around promoting holistic care, or even sort of blind spots that people tend to have when they're looking at pathways, because they're only looking at, you know, diagnosis and treatment. But the nurse always looks after, you know, and looks at that pathway more holistically, and in terms of personalized care, holistic care, can see what the gaps are there, and we can advocate for that. So thank you very much for the opportunity to speak. Delighted to be here.
Thank you so much, Tuti. So again, I know you cannot hear, but hear the clapping, okay? Because this is, both of you have been absolutely amazing. How powerful examples. And I don't know if you notice, any of you, but they are both speaking about something that it has not been 20 years of work, you know? They started not that long ago and they are already seeing very good results. So it's encouraging, you know, because normally we tend to see things that take very long. And I know what you say about EU taking a while to actually make changes, but you're already seeing changes even though it's taking a while. So thank you so much for everything. I'm going to invite, last but not least, our last speaker, Sylvia, my friend, who I will ask you the same that the rest of your colleagues. Please, before you start, and thank you for being here, would you mind introducing yourself?
Thank you, Celia. Hello, everybody. It's great to be here. My name is Sylvia. I'm cancer nurse specialist from Croatia, and I'm also senior lecturer at the Faculty of Nursing. In both fields, I have lots of years of experience. I mean, in the clinical settings or in the education. I'm also part of the EONS, European Oncology Nursing Society Education Working Group. And always, you know, it's a pleasure for me to participate in this kind of workshop, webinars, particularly when they are arranged in the cooperation between FT3 and GPON. It's my pleasure to be here once again. So I'm a member of EON's Education Working Group. I will try to introduce you with the EON's Advocacy Toolkit, which is the product of EON's Advocacy Working Group work. I will try to give you some, insight, and I will be try to be very, very short. But at the beginning, let me give you some kind of little reminder what advocacy is in general. So it is a deliberate process based on proven evidence to directly and indirectly influence decision makers, stakeholders, and relevant target groups to support and implement measures that contribute to the fulfillment of the rights of specific groups of people. Nurses in their daily practice are in the position to support vulnerable people who often are not able to speak up for themselves because of factors such as illness, mental capacity, or social position. However, for various reasons such as age, gender, attitude to power, personality, social situation, or conflict regarding professional roles, nurses may be reluctant to raise their voice for the patients. In such setting, nurses experience moral distress when they feel weak to proceed in an action of advocacy in favor of their patients due to external pressure. In cancer healthcare, cancer nurses have a crucial role in advocating for nurses, patients, and the healthcare system. Furthermore, cancer nurses can be leaders in different facets within their profession and show an increasing need to have a role in influencing policy, legislation, and in lobbying. There are useful documents and guides available on how to approach advocacy work, but none of them is attempting to highlight the key advocacy tools that are specifically of relevance to cancer nursing societies and cancer nurses. So please, next slide, Eleonora. So if you are a cancer nurse and have questions like this, are you looking for guidance on how to advocate for your patient? Are you looking for guidance on how to advocate for recognition of cancer nursing in your country? Or you personally have an ambition to improve policy in cancer nursing and occupational health, hopefully this EON's Advocacy Toolkit will help you. Next slide, please. So how all it's begun? One of the aims of the European Oncology Nursing Society Advocacy Working Group was to create a guide to influence decisions that improve cancer nursing status and recognition in Europe. The aim is to give readers ideas and inspiration for their own advocacy initiatives based on the realities of the environment in which they work and the way to focus on what makes a real difference in cancer nursing. The EON's Advocacy Toolkit is applicable for both individuals, to be particularly cancer nurses, and for the organizations, for example, cancer nursing societies, health settings, etc. In healthcare in general, for a better grasp of the concept of advocacy and in order to build a structured approach for sustainable advocacy so that all nurses can become advocates. EONS aims this toolkit to be a living document as advocacy changes over time and evolves, as we can see during the last two presentations. So next slide, please, Eleonora. The WHO describes advocacy for health as a combination of individual and social actions designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. So two main goals underpin health advocacy are protecting people who are vulnerable or discriminated against, and empowering people who need a stronger voice by enabling them to express their needs and make their own decisions. Both these goals are challenging when looking at the growing numbers of cancer patients combined with nursing shortages. A recent report shows that this leads to 21% of cancer patients that are getting treated but are not cared for. Even now, 25% of cancer patients have been lacking specialist cancer nursing support. One of the most important roles as a cancer nurse in patients' advocacy and is described as promoting patient safety and quality of care. When nurses advocate for patient, there is a possibility to fail, of course, and to experience many difficulties when addressing the rights, choices, or welfare of their patients. In the international literature, powerlessness, lack of support and law have been identified as barriers to patient advocacy that are faced by nurses, impeding them for satisfactorily fulfilling this role in accordance with their ideals. However, the way that nurses become effective advocates is, first and above all, to recognize themselves to be at the same level of the other healthcare and administrative members of their workplace, and try to obtain the support of their employers and the institutions at which they work. Patient advocacy is an important component in daily practice, and cancer nurses have a responsibility to advocate for the rights, values, well-being, and best interests of patients. For that, it is also necessary to do professional education and workplace learning and collaborative efforts from interested groups. Through these actions, they can help patients maintain good health, ensure quality care, quick recovery, and minimize the burden on the healthcare system. Education is necessary to increase nurses and student nurses' awareness of advocacy and to help them cope with contradictory situations and obstacles, even though it has been stated in the literature that experience gained in the nursing practice area is more crucial than education. ICN and the WHO call nurses to step up to the mark and get more involved in leadership, policy development, and advocacy. This call helping to drive leadership, policy development, and advocacy education for nurses. And with this, appropriate academic preparation will increase nurses' astuteness and skills. Next slide, please. So, advocacy and policy influence have been one of the core values and strategic goals of EONS. So with its strong leadership and through coalitions, EONS adds a vital voice representing cancer nursing views in cancer, nursing, and healthcare systems to support the goals of quality care, evidence-based practice, and nurse education and leadership. So this advocacy toolkit starts with an introduction. If you are interested, you can see. I will give you some more information a little bit later. And also introduction to advocacy in order to understand what it is in general terms and specifically in cancer nursing. Also, advocacy tools that can be used are described along with some good examples, and the practical checklist is included for advocacy. But they are based at the 4 targets in advocacy. And this is, first of all, advocacy in general in order to get a better grasp of definitions. Then advocacy for people affected by cancer as our most important pillar. Advocacy in nursing education to increase quality of care and create awareness among early career cancer nurses. And for the last but not least, advocacy for cancer nurses so nurses can back each other. So when we are talking about advocacy and policy influence, it's good to mention some of the EONS initiatives. For example, a RECAN project, which is focused on recognizing European cancer nursing. Then we have cancer nursing education framework, which goal is to, uniform, for example, curriculum for all the cancer student nursing. Then we have EONS work on safety, which is focused on work on patient and occupational health. Then European Cancer Nursing Index, which is focused on the development and progress of cancer nursing across Europe. Then we have European College Cancer Nurses. and several position statements and the joint letters that have drafted by the EONS Advocacy Working Group for the several government institutions. It is also good to mention, for example, some of other EONS initiatives or projects, whatever you want to call them. For example, building a young cancer nurses network in Europe, then raising awareness through digital advocacy, monitoring and evaluating advocacy, etc., etc. So for some kind of conclusion, I can say that one of the aims of the EONS Advocacy Working Group was to create a practical guide for nurses to become advocates in their field of cancer nursing. This document is meant to help raise awareness and to influence policy on the importance of cancer nurses' working conditions, but also describes how to advocate for education and, of course, for cancer patients. EONS wants all nurses to be able to become advocates. If you want to know more, like I mentioned before, you can find more information on the EONS website. And for the particularly this advocacy tool, I think Eleonora will give you the link in where you can find it. So thank you very much for your time.
Thank you, Sylvia, Gilani, Tuti. I think though we are doing a great example of different ways of doing advocacy, from real examples that have happened in oncology to real examples that have worked and changed policy in not oncology, but we could copy it to actually advocacy tools that we can go and inspire ourselves into. So I think you three of you are quite complementary to each other. So I'm really grateful for you. And using Dirty Dancing as an example, nobody leaves cancer nurses in the corner. So just remember that. I think you have, three of you, gave us the ideas and the empowerment to start getting into discussions. But before we do that, and learning from our previous experience, because we normally tend to get tangled into discussion, and the last time we almost didn't get everybody for a picture, I'm gonna ask Eleonora to stop sharing, and I'm gonna ask all of you that feel comfortable with being in a group picture to please open your cameras. I also think this is a great moment to do this because you may have questions, and I actually have some people that were willing to share their experiences. So if you feel brave enough to open the camera at the same time, I can see the three people that spoke, I can see them on the screens, so I can invite them to join us and share the experiences as well. I can see already one of them. I also want to say thank you to all of you. We have right now 44 people here, after many of you I already have seen on previous webinars, so I'm so grateful. Some of you, even with the mask and working, I'm double grateful. So thank you so much. So please do your greatest smile while Eleonora does a picture.
I see more
Okay, thank you,
cameras, so
Eleonora.
please keep 1 second the smile up, because there is one more camera that turned on. There you go. Perfect. Thank you so much. Go
Okay,
ahead, Celia.
much easier than joining everyone to a picture. Not as beautiful as the pictures that Gilani put, but this is the start of a global community part. So I saw around here that we have, and please apologize to me if I don't pronounce your name correctly. So just pronounce your name after me so I will learn how to do it correctly. So Gifty from Ghana is here. I don't know if you are here. That's but maybe audio is not working well, or internet. You know, after the blackout that we had in Spain a week ago, I know connections are not something to trust.
Hi,
Maybe
Gifty
in
is
the
here.
oh, hello.
Hi. Hi.
Would you like to share a little bit of the experience that you said when you advocate for cancer patients around financial and emotional challenges?
Yes, please. So I'm Gifty. I'm an oncology nurse specialist in Ghana, and precisely at the northern part of Ghana. So I work at the oncology unit, and I serve as a patient navigator too as well for the cancer patients. And so during the patient navigation, we are able to know the challenges that our patients are having, of which some are financial challenges, emotional challenges, and also some are also going through some form of stigma at home. And so through this patient navigation, we were able to track a lot of our patients. At first, we used not to be able to know their whereabouts when they are lost to follow up. But when the patient navigation started, we were able to trace them, know their problems, their challenges. And that was how come we were able to find out the stigma they go through at home, to the extent that some are even denied food at home. And you can imagine a patient on chemotherapy being denied food at home. And so constantly they come with anemia. So we probe further and we got to know that this was what was happening in the house. Some of them too, they also come and you can see that they are always emotionally down. And the part of Ghana where I am working, it's a polygamous area. And so a lot of them are in polygamous marriages. And so the sad thing that happens when the woman gets cancer, be it cervical, be it breast, they are neglected. And so they are emotionally drained. And you can imagine a woman going through challenges with cancer and emotionally she's down. It really affects their recovery. And so it helped us to also be able to bring in the psychologist to support these patients. And it also helped us to also organize this family conference whereby we are able to address the situation that the patients are going through and to bring on board the family members to support them. And also with the financial support, we are also able to reach out to NGOs and sometimes some members of parliament and some DCEs who are willing to support cancer patients. And we've got a couple of organizations like Embrace Society, Think for Africa, that has come to the aid of cancer patients in Tamale Teaching Hospital, supporting them financially and supporting them with breast prosthesis after mastectomy. And so patient navigation initiation at the Tamale Teaching Hospital Oncology Unit has helped us to be able to address the needs of our patients, and it's improving our survival rate as well. Thank you.
Thank you. I'm in awe. So Eleonora cannot ask me anymore about my aha moment. It's beautiful, and at the same time it's horrible to listen to such difficult experience, emotionally draining for absolutely every cancer patient, but being left in a corner like you cannot get the support, you cannot get the food, you cannot get the love that you need at that moment that you are feeling in your lowest. It's beautiful that people like you are changing the life of these people and giving them the support that they are not getting home, and educating the culture and the people so actually future people may not feel that stigma of cancer. So
we are even initiating this patient support system whereby survivors, we are bringing survivors together. those who are willing to volunteer to come out to advocate for cancer patients. So we've gotten some few survivors, and we are still putting them together.
Thank you. And I hope if you are able to join also into the break rooms that you can continue sharing that experience and actually inspire others in all the changes. Is Gidnora here from Kenya, who also wanted to share how she managed to convince a senior nurse about oncology nursing education?
I see her, but maybe there is some audio challenge, so maybe Celia. Ah, no, I see she commented in the chat. She's there.
Would you like to share now or maybe in your break rooms a little bit of your experience? Don't feel pushed into it. So just for background for people, we ask people when they register if they want to share some stories, and that's how I have the names. It's not that I'm putting people on the spot. But what I'm going to do is I'm going to give the floor to Eleonora so she can explain about the break rooms. And I'm hoping that not only Gifty, Gidnora, or also Gregory, who also expressed interest, that can share their experience in the break room, but that all of you can share your experience and ideas. So Eleonora will explain to us how the break rooms are going to work.
Thank you, Celia, and thank you so much, everyone, for the great presentations. I don't want to take too much time, but no, I'm very grateful to have witnessed to these presentations and eager to listen to more experiences and insights in the breakout rooms. So these breakouts serve to allow you to have discussions in smaller groups and brainstorm a bit on what you've just heard and continue sharing your experiences. So we are now going to move into 3 different groups. Just again to make sure that there is room for everyone to talk in a smaller group. And we have prepared a few guiding questions for you just to reflect on the current sharings. So we would ask you, together with the help of either a speaker or a GPON representative that will help moderate the discussion, we are going to ask you to reflect on the initiatives and the stories that you've just heard about, and if there are any elements that we can learn from these initiatives and stories, and what could we apply to different local realities. We would also be curious to know what is the kind of support that you would need to make advocacy happen in practice. And last but not least, if there is any other story, either your story or good case practice that you're aware of, that you would like to share with the community, we would love to hear about that as well. And so that's the purpose of the breakouts. Of course, if there is any other topic that you think we should be discussing in these groups, feel free to bring it up to your moderators. There is also a few of us, Celia, Ozioma, and I, that will be there to support in note-taking. So this is really your space to share. We'll make sure to share a full output with you once the workshop is over. To ensure that we capture your insights, we will leverage a tool that is called GroupMap. This is how it's going to look like. My colleague Ozioma will send a link in the chat shortly, and you can join this tool or not, as you wish. You are not forced to go there. So during the breakouts, you can either speak up, write in the Zoom chat, or enter this tool and enter your insights into the tool. And this will help us capture all your insights and keep up with the discussions that are happening in the different groups, even though we will be split, so that then at the end of the session, we can consolidate. And similarly to the output that my colleague Ozioma has beautifully presented in the initial piece of this session, we will shortly come back to you with a full output of this session as well. I see there is a question about a WhatsApp group. Yes, there is a GPON WhatsApp group that we invite you to join. Absolutely. So at the end of the slides, you will find the link to the WhatsApp group. So that's going to get there. Not for the co-creation as of now. So now I don't want to take too much of your time. I'm going to split each one of you into breakout rooms. Please do use, thank you, Celia. Please do use either the chat, your voice, or group map as the tool that allows you to share your insights. And I'll see you here in about 20 minutes for the conclusions of the session. Any question, you can always ask your moderators within the rooms. So I hope you enjoyed the discussions. There we go. Know that you may have felt like you were cut off for a second. I'm sure from our room, Sylvia was just wrapping up her point. So because I'm now going to ask to the moderators and speakers that were in the rooms to share their key highlights from the breakout and share with us a few learnings that you got very briefly, like 1 minute each. Maybe Sylvia, do you want to go? Because you were sharing exactly one of your key highlights when we were closing. So we start in reverse.
Yeah. Thank you. I can. So if Amar won't, he can finish. I would just want to say that maybe we should emphasize the role of the patients, you know, because I think they have much more power than nurses. And also another thing we should focus on is that we should doing much more about advocating for ourselves as a nurses. Patients, of course, they are always number one, but we can't forget, you know, for ourselves. So thank you all for all the participants for their time and patience. Amar, do you want to add something?
I think yes, I think in our group we focused more on knowing our roles and our responsibilities as nurses, and then eventually as advocates, as patient advocates. And we talked a little bit how we can move advocacy from the bedside up to the national level. Despite shortages and despite workload and despite being in a resource poor countries or hospitals, but I think we can always find a way um, to break that chain and then start being advocates for ourselves, for our colleagues, for our profession, for our patients, and eventually move on to a national level.
Thank you so much, Samara. And maybe continuing on the sharing of our great moderators, just to wrap up a few key highlights. Jilani, would you like to go and share your highlights from the group as well?
Sure. Yes, we had a great conversation, and it went from how can we do something globally, which I think is a great idea, you know, to make those connections, but also starting at the local level, understanding how your local government works, understanding the needs of your community, doing a gap analysis, and building from there. So making it the greater ambition is to build a global community, but to make it more accessible and bite-sized in a way to build confidence. And we had great discussions on the need out there for what nurses need to advocate for. And Gifty shared more of her experience on how she could advocate in her community as well, and perhaps sharing that knowledge with her colleagues.
Thank you so much. And last but not least, Julia, our amazing moderator who's been supporting every single session since the beginning. Would you like to share your highlights as well? Not the only person, but one of the key.
We actually had some great information in the chat. That's why I was begging you to save it, because people were chatting back and forth so fast and our board filled up really quickly. But I'd say the highlight, we had two people who came on microphone, both from Kenya, but not the same cities, talking about the information that needed to get out in the community about cancer and what how it was understood and perceived by the community. But one young man, Micah from Eldoret up in the north, he's doing social media. So the power of social media. And Gidnora mentioned also she really hopes telemedicine will come to her hospital, because the need to reach out to people in their communities and in a wider and broader way. So harnessing maybe social media from others, passing on messages that are truthful, accurate, and informative to communities, and creating what GPON does, connecting people so that we're not all making our own resources all the time from scratch. We can use messages that others have already created. And the fantastic resources Jelani showed, Sylvania showed, and Tutsi showed, just that we can harness what others have done and carry it forward would make it easier for us to just when we're beginners in advocacy. Thanks.
Thank you so much. And of course, Salia, you always have a final word to share before we close this meeting. So anything that you would like to add?
Actually, no, I think they have said it all. Thank you.
Perfect.
Thank you so much. Like, really, thank you. Thank you to all of you for your insights.
Great. So I'm just gonna share my screen for 2 more seconds, just to wrap up this meeting, and provide you with a few links that may be useful moving forward. Of course, thank you so much for the insights shared by the moderators, but if anybody else would like to share your insights, please stay tuned 1 more minute, as there's gonna be the feedback form, and that's a nice way in which you can share your insights from this discussion, and you can allow us to collect them all and reshare them back with the group. And if in these 2-3 minutes you wanna type something in the chat, we'll save the chat and make sure to include it in the final output as well. So let me get to how our journey continues. We are only 3 minutes away from the end of these sessions, but definitely not the end of this amazing platform for the global nursing community. It's been an honor to see how you have engaged and you as a community have grown throughout the past 3 meetings. And we definitely don't intend to stop these whole efforts here. So while we will take the summer to reconvene, summarize properly the outputs from this session, the previous session on education, which you can find on signups if you have not attended, and the link is going to be in the slides. We invite you to still stay engaged. So shall you be interested in joining a multi-stakeholder group and multi-stakeholder discussions? FT3 has a few of them upcoming. In the feedback form, you can let us know and we can loop you in. We've talked a lot about the importance of patients and the role of patients as primary drivers in healthcare in general. And we have a great opportunity for you to listen to great experiences of when patient engagement has really made a difference to initiatives that are also connected to oncology, but not just limited to that. That's the Made with Patients Awards. These are awards that are given annually to great initiatives that showcase patient engagement practices. Shall you be interested, my colleague Osioma will send a link in the chat for you to register. There is a nice ceremony happening in June that you can join virtually so that you can get inspired by stories in which patients have really made the difference, and also learn more about how could you help engage patients a bit more structurally. When it comes to resources to explore, and still as a final call to action, some of you were asking about a WhatsApp group. We definitely also invite you to join the GPON WhatsApp group. That's an amazing global nursing community. By the GPON WhatsApp group, this whole idea started because we were looking for a few contributors, and then there was an overwhelming response from the global nursing community that is gathered thanks to GPON. And so that's how we decided to join efforts and come together in this nurses community of practices. So definitely do join that WhatsApp group as well, and keep on interacting with your fellow nurses around the globe. We also invite you to join, and again, my colleague Osioma should be sending the links in the chat shortly. We invite you to join the Precision Medicine signups, which is virtual ecosystem for precision medicine. Precision medicine is the future somehow of oncology. We know there is a lot that we hear within oncology and beyond oncology and precision medicine. So if you're interested to connect with the network, find out the different initiatives that are around that, we invite you to join that. Of course, check out the ICN Nurses Code of Ethics and the IANS Advocacy Toolkits that were presented today. And within the slides, you'll also find the link to the example that Toti has shared. We also invite you to check the Precision Medicine Toolbox from FT3. And for any question or any need, you can always reach out to me and I'll make sure to direct you to the right person. So I'll just act as the main point of contact, but of course, it's not just me. There is a full, beautiful team behind that you've seen, even though you've received a few emails from my side. Feel free to reach out to me at any moment and I'm happy to support or connect with you. And last but not least, here's the feedback form. Please do fill this feedback form by May 31st. As for the first 2 workshops, this feedback form will also allow us to produce your attendance certificate. So shall you be interested in receiving an attendance certificate for this workshop, do make sure that you're filling this feedback form. And generally, it is key for us to hear your thoughts, hear what you would like to see next, what can we improve, how can we serve you better. And so please do take a few moments to fill that, and the link is going to come soon in the chat as well. And we will also wrap up all the resources in our follow-up email that you can expect by the end of this week. And I leave it to Celia that I think wants to close with a few words, I guess.
Thank you, Eleonora, and thank you everyone for staying 2 minutes. You can see Eleonora was talking very fast. It normally does not, but we don't want to keep you up more. So we are not giving you a date for our next webinar because we are taking summer to actually dive into all of these discussions. And we are hoping to come back to you after summer with another session and more ideas on how we can actually make this into actions and not only discussions. So thank you, everyone, and I'm hoping that you will join us in September again.
Thank you.
Thank you.
Thank you.
Bye-bye. Thank you.
Thank you. Bye.